New York City Mayor Eric Adams' new long-term strategy to fix the Big Apple's homeless crisis is stirring controversy.
If severe mental illness is causing someone to be unsheltered and a danger to themselves, we have a moral obligation to help them get the treatment and care they need.
His plan, announced this week, involves hospitalizing severely mentally ill homeless people, even if it's against their will. Adams said the city will pair clinicians with police officers into teams dedicated to getting New Yorkers in crisis into care.
These specialized intervention teams will have the training, expertise, and sensitivity to ensure that those in need are safely transported to a hospital for evaluation.
Adams also plans to provide officers with a phone line to consult medical experts directly when dealing with cases of mental illness. And he wants to build a continuum of care, so those hospitalized aren't simply sent back out into the city a few days later. But the New York Association of Psychiatric Rehabilitation Services CEO Harvey Rosenthal says the reality is that hospitals are already overloaded, and the issue should not be dumped on law enforcement.
The mayor's talking about training the police, and the police will get a hotline. It's just too much to vest on them. And frankly, there's been too many tragedies on both sides. So, we don't need more arrests and incarcerations and tragedies when it comes to involving the police.
Rosenthal warned the plan could raise legal questions and may lead to lawsuits.
If people need housing, they should get housing. If people need a crisis support, we have plenty of supports, new ones and old ones, that are not the emergency room in a hospital. So we're looking at an institutional sort of solution that is probably a violation of rights and certainly the wrong way to go and a traumatizing way to go.
New York City has seen a rise in violence, including random attacks on subway riders in the last year. Adams and New York Governor Kathy Hochul have vowed to address the issue by expanding mental health services and stepping up police presence on subways. The mayor's office said on Tuesday the city would begin deploying co-response teams of health workers and police officers to patrol high-traffic subway stations as more homeless people are expected to gather there during the winter months.